Tuesday. Dr. K's here from All Valley Animal Care Center in Meridian. And we're talking about cats with abscesses this morning. So Dr. K, it kind of sounds like outdoor cats, cats that maybe get into a little bit of mischief are more prone here, right?
Correct. Especially this time of year, like the female cats are coming in heat. And so what happens is we have a crossing of the territory boundaries. And so we have male cats and female cats going on property that's not theirs, and cats don't like other cats out there at their home, and they get in fights, you know. Then they get bit, and then it causes initially some sort of swelling, and then if it is not treated, then it swells up into an abscess.
Okay, so what are pet owners looking for on their cats?
Well, sometimes if they get bit in the leg or something, that's pretty obvious because they'll be holding a leg up or something like that. But sometimes they'll get bit in the lumbar or the back area. And it's not that evident, you know, if you don't pet your cat, it's not that, you know, some cats like to be petted, some cats don't want to be messed with, you know. And so what you'll see in those cases, you'll see that, you know, the cat's not moving, it seems irritable, sometimes it'll be painful, and it'll just be laying around, not looking right, not eating very well, then you know your cat has a problem. And at that time, hopefully, in a day or so, you'll realize, hey, my cat's got a problem. Okay. Take it to your veterinarian, and then we can do an exam, and usually they have an elevated temperature, and we, you know, history of an outside cat, and generally we, you know, if we feel the cat, and then normally we're going to find it.
Yeah, and it's going to be kind of a softer spot because it's filled with pus, correct?
Oh, it'll be painful, something like that, too.
Okay, but there's ways to treat this. It needs to be drained, correct?
Correct, because it's a collection of pus, and a lot of times we give them a little anesthesia, and we open the abscess up and drain it, but we have to make a big enough hole, or sometimes we put actual drains in, so that drains the infection away and keeps the wounds open so that the abscess heals from the inside out. And of course, they're put on antibiotics and some sort of pain medicine in general.
And these can be pretty serious if they don't go treated.
Right. Sometimes if you don't treat them, they just kind of open, close, and they get bigger, bigger, bigger because we can't, the abscess keeps reforming. So that's why it's important to get it done and correctly, and then your cat will be safe.
Okay, and there's a couple of shots that they're going to get if they are treated for an abscess?
Right, they'll get an antibiotic injection and a pain injection, but the other thing, we generally do a blood test for feline AIDS and feline leukemia, because that's how it's transmitted through bite wounds, and hopefully your cat has at least a feline leukemia vaccine, so it can help in that prevention of that problem. Yeah. And of course, if you're new to your male cats, it will certainly help that problem too. And spay your female ones.
All right, there we go. You've heard it all. Right.